What are the prescription limitations for virtual doctor visits? Imagine being able to see a doctor from your living room and get the medications you need without leaving home. Virtual doctor visits are changing how we access health care. But did you know there are rules about what can be prescribed during these online appointments? Let's explore how prescription limitations work in telehealth. First, prescribing controlled substances, like certain painkillers and psychiatric medications, has specific federal rules. Currently, doctors registered with the Drug Enforcement Administration can prescribe Schedule II to Schedule V controlled substances through telehealth without an initial in-person visit until the end of 2025. This rule was put in place during the COVID-19 pandemic to make care easier. After that, a new registration process might be required for remote prescribing of controlled drugs. If a patient has already had at least one in-person medical exam with the doctor, then the provider can prescribe any medication, including controlled substances, through telehealth forever. But if no in-person visit has happened, the doctor might face restrictions on prescribing certain drugs. For example, Schedule II drugs, like some opioids, are limited to less than half of a provider's total monthly prescriptions unless special exceptions are granted. This can impact specialists such as psychiatrists or pain management doctors. State laws also play a role, most states requiring a valid doctor-patient relationship before prescribing medications remotely. This usually means an exam either in person or via video call. Some states do not accept online questionnaires alone to establish this relationship. Also, certain medications like medical marijuana are often not allowed to be prescribed through telehealth in many states. When it comes to medications that are not controlled substances, the rules are generally more relaxed. Providers can prescribe common medicines, mental health therapies, or treatments for chronic conditions if they have established a relationship with the patient. For telehealth platforms, compliance with federal and state rules is essential. They must have proper DIA registration if they are involved in prescribing controlled substances. Patients benefit from easier access to medications, especially for mental health care or ongoing chronic disease management. Remote patient monitoring can also help ensure patients take their medications correctly over time. Setting up a telehealth appointment usually involves scheduling through a platform or provider portal. During the virtual visit, the doctor will evaluate your symptoms and medical history via video or audio. If they decide to prescribe medication, they will verify your identity and ensure they follow all legal requirements. For controlled substances, documentation and compliance are especially important. In summary, while virtual doctor visits make it easier to get many medications, there are federal and state rules that limit prescribing controlled substances without an in-person exam or special registration. Non-controlled medications are easier to prescribe remotely. Both providers and patients need to understand these rules to stay compliant and safe.